Okay, so this is James Esty with the GVU MSAT program, and this is my ATGR 536 advocacy project. So for this, I went with pushing a more patient-focused care model at Grinnell College. So basically, what that entailed was a multitude of, we don't really have a care model in place at Grinnell College. We kind of have a hybrid between all the different teams on whether and like what exact metrics we use on each individual team. So like for football, for example, a lot of it is coach based, so like stakeholder based on X player needs to play this weekend. What can we as clinicians do to make sure that they can play their best this weekend? And the idea of this project was to educate and inform and then, make a push to kind of change that care model a little bit on to kind of turn that model to the patient saying it's like I'm in pain, can I play? And then that patient makes that decision based off of education and like clinical decisions made by the medical staff. So just kind of taking other stakeholders kind of out of like what the patient has to do, like playing and practice time wise, and kind of putting more of that leverage on the patient and the clinician. So the why. So to basically it's reduced to reduce pressure on athletes and athletic training staff. So there's often a lot of pressure placed on both parties for these athletes to be rushed back into play, like the example with football. Like before they're ready. It's like coach wants them to play, coach says they need them to play. Like we're at times expected to get them back to playing, even if they're not ready from like a clinician outstanding point. And like I said, GC athletic trainers and like grad assistants like myself are often pressured by coaches and occasionally parents, since they're often present at events, to return athletes before they're ready. Um, we often get pressured to kind of like change our plan of care because the parents want one thing, but what we think is a different thing. And there's just a lot of pressure from outside stakeholders on the patient clinician just relationship on trying to get them back to playing and being healthy. So effort one, meeting with athletic training, coaching, and administration. So the this is technically it's really three mini parts in this one effort. So the first one was like meeting with AT staff and basically discussing kind of like the issues we have with this current model, how we feel pressured about these things, and then like how can we kind of take the power kind of back to ourselves and to the athlete on making that decision of are we playing or are we taking time off. So and really like a lot of that was more based on just like stress on AT staff is it's like trying to rush through rehab processes and like just trying to come up with ways that this athlete can play pain free is oftentimes extremely stressful along with trying to work with other patients that are going through similar things where if we can switch to this patient-centered model, we can then we have a little bit more freedom, a little bit more time to like make these clinical decisions and run these patients through like a real structured rehab rather than trying to rush them back before they're ready. And then the second and third part really, we're meeting with other stakeholders with how they perceive the current patient model and how they would receive a more patient-centered model. So what that entailed was meeting with coaching. For me, it was mostly the football team staff, since I didn't have a lot of exposure with the other coaching staff, but did what I could. And they were understanding of where we were coming from because they are aware that they know that they had a couple athletes where they wanted them kind of rushed back a little bit. And from a patient model, like it sucked for those athletes. Like they didn't want to do that, but again, they felt pressured. They felt like they couldn't tell the coach no. It's like the coach wanted them to play, so they felt like they had to play. And then with the more patient-centered model, it's like, okay, these athletes, like, they didn't want to play. A lot of them we had to hold out, like they would play a little bit of the game, they would re-aggravate their injury, we'd have to pull them out anyways. So it's like if we had just taken that game off, we probably like we wouldn't have to deal with this next week, just trying to get this pain to go down again and like restarting this injury process. We instead would just be able to pick up where we left off and just continue this rehab process, and then maybe they'd be ready for the next game. So instead of being painful and limited for 2 to 3 games, maybe they would have just missed a game and like a week of practice, and then they would have been healthy going forward. So that was kind of like how I like projected this project to them and like my ideas on like switching to this model. And they were fairly receptive to it. And um, so again, the population, athletic training staff, coaching staff, athletic administration. So in athletic administration was the same thing that I did with coaching staff. It was like I met with one of the assistant athletic directors and we sat down and we kind of talked about what are ways we can just figure this stuff out. Like how can we kind of give that power back to the athletes instead of like having the coaches really decide if they're playing or not. And a lot of that was education. Kind of like what we came up with was education. It's like getting these coaching staffs like this is what happens when like we play through injuries. Like we're out for longer, we are more likely to miss games, we're not going to get as many snaps as we might want them to get at key moments throughout the season. So no immediate changes were made in the Grinnell athletics department. I mean, it's just a project, 1 semester, not a lot we can do. And then these meetings were done post football season. So, but going forward, these coaches are now educated on like the whys, on like the why we need to like actually take this time to rest and recover, even if these injuries seem like minor things. It's like maybe we need to miss a few practices, maybe we don't play this weekend, but like they're now educated to know that it's beneficial to hold these athletes out for a little bit so that they can be healthier going forward instead of just having to deal with it and be playing at suboptimal level throughout the season. The second effort I had was my NATA outreach. So for this step, the plan was to reach out to NATA IO rep. Her name is Megan Ludstrom. She's affiliated with the University of Iowa. So with her, I was hoping to gain access to resources and individuals. Since again, she's a rep. She's been doing this for a lot longer than I have, and so she might know some resources or just have some ideas that I just haven't thought of to kind of help with this project of mine. And then I would branch out from there off of the resources and information that I would have gotten from Megan. However, she never responded to me. So, or sorry, this is population. So the NATA Iowa rep, and then individuals connected to the NATA rep, and then like a secondary population of that would have been staff, the coaching staff, AD, and athletes who would then have been distributed that education. However, I spoiled it. Um, at the time of this presentation on December 7th, I have not heard back from Megan Lundstrom. So unfortunately, I wasn't able to carry through with this effort. But hopefully she'll get back to me at some point, and then I can kind of outside of the class kind of carry on this project and kind of give the education I would have gotten from her to the coaching staff, since I will be seeing them, next semester along with the new staff that I'm currently working with women's basketball and track and field. So effort 3, the infographic. So this graphic on the right was one that I put together myself. Got the okay from Carissa, Jason, and Mike, my supervisors, to kind of hang it up in the athletic training room. It was up there for about a month, basically the month of December, and it was recently taken down so we could put up our Christmas decorations, and hasn't been put back up yet, and it might not get put up until I go back to clinical in January. But basically, this was right on the window going into the ATR. You essentially cannot miss it going in. Like, you are going to see it. And then you will also see it on the back side, since it's glass, it's on both sides of the glass. You will see it leaving, you will see it entering. And basically, it just has various information about like what is an injury, some facts about playing through injuries and kind of the downsides of doing that, a quick example of just kind of like if we don't play through one, we take time off, this is what happens. If we do play through one, this is what might happen. And then just some like tips on like what an athlete can do, regarding an injury, or like maybe their teammate has one and that the teammate hasn't come in to see medical staff or gone to coaching or anything like that. So the population, Grinnell ATR has about 50 or so athletes every day that come in and check in. We get this data from the check-in desk. There's probably more because not everyone is great about checking in, but it's around a 50 average, give or take a couple. And then the various coaching and athletic administration staff that come in throughout the week. Visiting athletes and coaches are also in the ATR and walk by that same sign. So if they're also able to stop and read it as they come in pre and post game for taping, ice, hot packs, whatever else they might need. And then results and changes. So most of the coaching and administration staff that saw this poster really liked it. They're like, it's informative, it's simple to read. It kind of gives a basic idea of like, oh, it's not a good thing to play through an injury, and that it also kind of broaches questions from athletes and coaches about like, well, what about this or that? So a few athletes were kind of asked about this infographic. A lot of them kind of already kind of knew the information, thankfully, which is a good thing. But others kind of found it informative. Maybe they didn't know that it's just better to take time off. It's like if you take time off, it's like, oh, it's like I'd only miss a game instead of like 3 or 4 if this injury continues to get worse and worse and worse. And then the changes, it's like, so there's no immediate changes as this is just something people read. However, the hope is that in the long term, the information and education that this infographic provides to athletes, students, athletic administration will kind of improve overall student health and safety in the area of injuries. It's like athletes and these coaches are now a little bit more educated about like the risks of playing through injuries, and therefore we should have, at least on paper, less cases of athletes playing through injuries.